Welcome to Raising the Bar, the podcast that pulls back the curtain on the country's most successful leaders and how they elevate their business and their teams. Please welcome our host, Alison DePauli.
Hey everyone, it is my pleasure today to welcome Dr. Roger Moczygemba to Raising the Bar with Alison DePauli. He is a friend and the owner of the Direct Med Clinic, and like me, he is on a mission to change healthcare. And we're not going to talk so much about healthcare today, but we're going to talk about how you take your occupation and become an entrepreneur and why Dr. Roger did that. As you know, Raising the Bar talks about all things CEO and executive team related, how to leverage what other people have learned and take that and build your own business. So welcome, Dr. Roger. Thank you so much for spending some time with me today.
My pleasure. Glad to be here.
So let's talk right about how you made the decision to evolve from physician to healthcare entrepreneur, because I think you've really done some remarkable things and some remarkable things for employers.
Well, thank you. I didn't set out I never told myself, oh, now that I'm a doctor, I'm going to become an entrepreneur. But I think it was just something that was part of my internal drive, something that just led me down that path. I'm always, it seems like looking for a better way to do something or create more value with the way something is being done. So I think that's kind of just the internal theme that I have, I think. And as I was thinking about coming on your show and talking about this, I was kind of reflecting on why that is, or where that came from. And I think it probably goes way back to when I was a child. Actually, I grew up in a family that was kind of dysfunctional, and my parents and relatives, none of them were college educated. So all good people, just blue collar workers. And then through some associations that I had through church as a young man, I served a mission for a couple of years and started to rub shoulders with other folks that had gone to college. And then, so I decided I was going to do that. So I set my sights high. I set a goal for myself to go and do that. And I'm kind of driven that way. So I achieved that goal and I graduated from. And
you are an Aggie, no less.
Absolutely. Yeah, that was a high goal to go from in high school, not even being considered college bound. Then I took a couple of years, actually 3 years off after high school, and did my missionary work for a couple of years, and then decided to go to A&M. So I went from not even wanting to go to college, not even having an idea the importance of that in high school, then 3 years later, by the skin of my teeth, getting accepted to Texas A&M. And so then I had this goal of being a veterinarian. So I knew I had to make really good grades to get into vet school.
I didn't realize that.
Right. So I went there and started doing all that. And I graduated with honors. After a little while, I tried a couple times to get in vet school early, but then I was accepted. But by that time, I'd already changed my mind that I was going to go to medical school. So I did. And then when I got into medical school, that was a great experience. And I trained in the Navy after medical school. That was a wonderful experience. Then to kind of get back to your question about how I went from doctor or physician to entrepreneur, this was a time back in the early 2000s when the internet was starting to change the way that everybody did things. So I was at a position at that point in my career as a physician that I needed patience. And I thought, I'm gonna open my practice, hang my shingle, and I'll tell you what, I'm gonna guarantee that if people schedule an appointment with me online and pay for it up front, then I'll go ahead and see them right on time. And so they won't lose any time, because for busy people, time is money, right? So I launched that business, and that was back in the early 2000s. And so right after I launched it, I found out that the doctor I was sharing an office with was actually committing fraud with my credentials, and an attorney told me that I needed to just disappear and get out of there. So I did. And so then the business that I launched, it worked a few times, but I never could continue to grow it because I had kind of the rug pulled out from under my feet. But so that was part of that transition there. And then that was recognized by another doctor in town that, that said, hey, why don't you come and join our group? And then that led to me becoming, well, that gave me a place to practice. And then he also recognized that I had a little different skill set or mindset. And so that led to me becoming the president of the Teladoc Physicians Association in 2004.
You did that for a long time.
That was for 9 years, right? So me and a couple of other doctors helped to establish the Physician Association for Teladoc, which entailed growing the nationwide network of doctors, establishing what kind of things we would treat through telemedicine, what we wouldn't treat, what medicines we would prescribe, and which ones we wouldn't. So it also had us put together the quality metrics for controlling that nationwide network of telemedicine.
How difficult a project was the quality metric?
It was just a matter of figuring out what made sense to us, and then having the right people to monitor it as it grew. And what I mean by that is that, we as doctors know what quality medicine is. We know what the standard of care is. So it was just a matter of defining that in the realm that we were working, at that point. So to a doctor that's trained and has a little bit of experience, that wasn't really hard. We just had to set some metrics to it, and that's what we did.
Why do you think that there is so little information available to a garden variety person, let's say me, about how to find a quality physician?
Oh, wow. Well, my feeling on that is that the health insurance companies sort of captured that, and they now own it. So they're the ones that dictate all of that these days. That's my opinion on that.
And you are on a mission to change that, I think.
Well, I didn't set out to say I'm going to change that, but my approach is just to take care of the people in front of me and take care of my business. Like every time I'm in a room with a patient, it's a one-on-one thing. And I just like any doctor, you talk to your patients, get a history, and then you prescribe them the treatment. So in my business, it's similar. We like to think that we can take the same approach. And if a business owner has a problem with their healthcare benefits, well, let's talk and let's see what the pain points are and see if Direct Med Clinic can help that. And I think we're starting to develop a track record of doing that exact thing. So,
Yes,
yeah.
I know that. But I think doctors and medicine are almost mythical to people still. And I think that medicine is both art and science. And doctors, fortunately, still have huge positions of trust. But that doesn't always work in the interest of the patient, particularly when there's an insurance network involved for reasons that a patient would never understand. And I think that it's very interesting to hear me talk to you about being a doctor and being a business owner, because you are a business owner. And I think so many people don't think of doctors as business owners. It is your job to deliver high quality care at a price that's profitable for you. And I think the more we talk about that, the more we can change what's happening. I don't think insurance is profitable for physicians for the most part. And I think that most doctors just want to deliver care and be paid fairly. I think that in my experience, that's what doctors would like to do. They don't want to have 10 billing people because they can't get paid. And I think you've done a great job of showing employers how they can absorb some modest risk, pay a fair price, and actually do better for their employees. Do you want to talk a little bit about how you do that for employers?
You bet. So let me go back to the one thing you said about doctors and business owners. These days, most doctors are not business owners. They're basically employees of a large group or, a healthcare system.
Yep.
So,
and I'm going to go out and say that is bad for patients.
And so one of the things that I think sets us apart is that I do own my own business, the clinic. And the thing that allows me to do what I do is that I'm the decision maker and I can provide care the way I want to. Mm-hmm. And I can customize that care for an employer client, which we do market to employers. So it's similar to, like I was saying earlier, to, customizing the care plan to an individual patient, or customizing a healthcare plan to an employer. And I say healthcare plan, and that's our direct primary care model. Yep. And that's a beautiful thing. And I'm so fortunate to be able to practice in that model now. It's been 4 years. So that's kind of, I think, the magic that you're looking for. You want me to talk about. It's this direct care approach where I've gone to medical school and I got the training and the experience to deliver health care.
Yep. And
so I know how to take care of people when they're sick. And so if you have a business and you need a health care benefit, then wouldn't it make sense for you to contract directly with somebody that knows how to provide that? So that's me, that's my clinic. So we all know that insurance is important, but it doesn't have to be involved in everything, Yes. So when insurance was designed, it was to take care of the big things. And so the more that we can use it for what it's actually designed, and the more we can let the doctor and the patient get together, or the company and the clinic get together, the more value can be generated. I mean, yes, we have a motto in our approach. It's called data: direct, accessible, transparent, and affordable. And so I love that because it allows me to do what I'm trained to do, and I provide that service to patients individually and then also to companies. And so we just, I mean, everybody would rather buy direct if they can, right? So that's essentially what we're doing in this model. We're just showing people that healthcare is not as expensive as they might think it is. I tell people all the time that when you hear about healthcare in the media, they're probably talking about health insurance. They're not talking about health care, because that's what's really expensive.
Yes.
Health care is what I do, and that's not expensive. If you go to our website, all the prices are posted online, and you can see all that. And we can deliver that care affordably, and I just love being able to give people access to care. And we did that in a wonderful way throughout the pandemic. And we kept people out of the hospital because we gave them access to us and early treatment. And that's a beautiful thing. And that's very gratifying for a doctor.
Exactly. You want to deliver care. You went to medical school to deliver care to patients, not to bill insurance. And I think, people confuse health insurance and healthcare quite a lot. They're two very different things. And, with my professional hat, I look at claims all the time. And I can tell you that 10 to 20%, typically 10 to 15% of an employer's population is driving 80 to 90% of their claims. And I've seen that now across many employers. That's just how it goes. So I think if you can give employees access to care, then you can make sure people get their routine physicals. When they get the flu, they have somebody to call. All of those kinds of things keep people, watch if somebody has an elevated A1C level, a conversation about diet and exercise, and then maybe medication, and deal with all of those things when they're small, so that this large spike, this 80 to 90% of your claims also gets reduced over time. It is a different way of thinking about health insurance and health care, and more employers than you would think can do that. And I would say more employers than the public thinks can do that. You know very well how employers can do that.
I would say, I don't know why any employer couldn't do that. Now, the smaller ones can do it, whenever they're ready. But the larger ones, they need something that's going to be ACA compliant.
Correct.
So with the skills of somebody like you, you and I can work together with that employer to get the best of both worlds, right?
Yes.
So
there are many ways to skin a cat.
Right. And so that's it just makes so much sense, to get healthcare directly if you can. Yep. And it's so affordable. And
you've done two other things that I want to talk about. One is you do not only patient care, but you do workers' comp care as well. And you do that both in person and virtually, I believe.
Yes.
And you do that, you again, just make it more accessible. And I think you keep things recordable, but not reportable, which can be a very big financial boon to an employer. And I think that's often overlooked. So how did you get into that space? Well,
I've always sort of been attracted to companies, construction companies and manufacturing and all that. When I was working in a physician group early in my career, they had these employer clients that had injured workers. So I learned early on in my career as a physician, what those companies need. And I learned the difference between a recordable injury and, what they have to, treating an injury with first aid rather than prescribing ibuprofen or something like that, So I learned how to do that. And then once that word got out, employers would bring their people from, drive them a couple of hours to see me, just so because they knew that I would help them prevent a recordable injury, at the same time taking good care of the injured worker.
Yes.
So I did that for years. And then with my telemedicine experience, and when I started Direct Med Clinic, it just was a natural thing to offer the virtual care to injured workers. Now, the NCCI says that 85% of injured workers have bumps, strains, and overexertion. So that kind of thing can be treated all day long with telemedicine or virtual care. So that's what we do in the virtual workers' comp clinic.
And I think you also can integrate doing the workers' comp, so keeping that cost down, and then doing the direct patient care to the uninjured employee population. And you've done that successfully in many employers, I believe.
Yes. So when an employer enters into a direct care agreement with us, we're their doc. We're managing their diabetes and hypertension, but they're paying us to take care of their people also. So when someone gets one of these work injuries, we're going to see them and we're going to take care of them. And like I said a minute ago, most of them are sprains, strains, and overexertion. So the employer doesn't have to file a claim to workers' comp. They can file a $0 claim just to notify the work comp carrier that there's been an injury, but it makes so much more sense economically for the employer to just pay directly to have that injured worker taken care of. And so with one company that has about 400 or 500 people, when we first started doing that with them, we saved them about $1.7 million on avoided workers' comp claims because we took care of them directly and we took care of them in-house. So yeah, that's a beautiful thing.
And that money goes directly back to the employer's bottom line. It's money they have never spent. They don't have to claw it back. They don't have to do anything. It literally goes right back into their bottom line. And I think that the more we talk about that, the more employers realize what is possible. And in my experience, I don't have any, as a matter of fact, who say, well, we just want to cut the benefits and offer the cheapest thing. I don't have those kinds of people. What I hear is always, look, we'll spend the money, but could we help these people? Because this is not working. And to me, your model is much more effective at getting care directly to people. And the happy side effect is a better budget.
Well, let me mention another nice dynamic that's created in this direct pay relationship. So when Direct Med Clinic or any clinic in this direct pay model gets when we start in that, we're taking care of these injured workers and we're doing just what they need. We're already paid. We're paid through the direct contract. So when we're not going to be generating a claim to send to the work comp insurance carrier, then we are not looking for extra charges to put on that claim. So we don't, that's another way to save. We're not adding cost to the healthcare that are not unreasonable.
Yes. And the other thing that you've done that I think has been very beneficial, and I want to talk about a conversation that we had at the last event, was founding the chapter, the San Antonio chapter of the Free Market Medical Association, which seems to be growing very well and attracting not just providers, but employers.
Excellent. Yeah, I'm glad you brought that up because it's amazing that we live in this free country, but if we really look at our healthcare market, it's not a free market. How could it be when there's no price transparency? So what the Free Market Medical Association does, its whole mission is to combat the high cost of healthcare through price transparency. So what we've done in San Antonio is, with all of our meetings, we try to get together the employers who pay for healthcare and providers, doctors and facilities that deliver healthcare, and create this community of price transparency. And then we invite a few brokers to these meetings as well, to help make it all compliant. But the whole goal is to get the parties together, the doctors and the payers, to say, look, here's, you have people that need this kind of surgery. Here's a surgery center with cash pricing available, or here's a doctor that does this kind of stuff here. You can use that doctor, pay them directly, and you don't have to file a claim. So I'm so glad that it seems to be growing, and we are getting more and more attention and more traction in what we're doing. We're just trying to create this free market healthcare community in San Antonio. And I hope, if you're listening to this, that you'll check this out and come and join us and help us, fight the high cost of healthcare through doing this little thing for us, for our community in San Antonio.
And I think when people hear DPC, if they even know what it is, because many do not, they think direct primary care. But actually, the evolved definition of that is direct patient care. Because we have in San Antonio, I think we're very fortunate, not just primary care physicians. We have a whole host of specialty physicians that have cash pay practices and deliver very high standards of care and have good track records, particularly endocrinologists, about helping people be healthy.
We do. And another thing about direct patient care is when we remove this idea of a doctor having to bill for charges, it allows the doctor to focus a lot more on just exactly what the patient needs. And I'm just going to explain that in this way, that sometimes it might happen that a patient is talking to a doctor about this or that, or they're asking for a certain kind of treatment, but the doctor is not going to go there because that's not something that they can bill for. So, when that happens, it's unfortunate. So direct patient care, does enhance the doctor-patient relationship in that way.
I think it does. And I think that many people don't realize how hamstrung a doctor can be. My mother's, I use her as an example all the time because, she's my mother and I can talk about her when I have a HIPAA issue. And she has a lovely primary care physician whose practice was purchased by a hospital system in San Antonio. And I asked her to ask him something, and which she did. And he said, I can't do that. And I was like, what do you mean? And I think that oftentimes people don't ever push beyond that, and they don't understand why. They think maybe it's not medically appropriate, and that is not necessarily the case. Whereas
Exactly.
when you have a provider that's more independent, you're going to get an opinion. This is the right or this is wrong, but you're going to get an opinion. You're not going to get well, my practice doesn't allow that. And I think that's a really, really important distinction that a lot of people are not aware of.
Well, even that being said, that doctor is, if it's his opinion, he is still responsible for that patient's care. So
Correct.
He's not going to let them go. I mean, there's that responsibility that we have with doctors. So that doctor is still acting in the best interest of his patients.
Mm-hmm. Absolutely. What is your best parting advice for an employer who is looking to do a bit better for their employees?
Well, I would say look into the direct pay options. There's, I guess you have to find some trusting people to sort of show these options to you, and maybe show you some baby steps or hold your hand as you're making some changes. But with a trusting consultant like yourself, or a trusting doctor, I would say start looking into it and share it with your executive team, and start making some relationships, and start taking some baby steps. Just try this or that. That's what I would say. We don't want to, I'm not saying take a big organization that's got a good thing going, and there's always something, right, when you're running a business, and make big changes. But start looking and comparing, and then take some baby steps, probably.
I give people that advice all the time, and yes, I am an advisor and a consultant, and there are one or two others in San Antonio that work in a similar way than I do. It's not just me, and I think the tide for that is changing. I think we'll wrap it up there, and I will drop a link to the San Antonio Free Market Medical Association. If you are an employer, come check it out. And also links to Dr. Rogers' clinic, so you can find out a little bit more about him. And thank you for listening. Today's show is powered by Altiqe Consulting, and we will see you next time.
We hope you've enjoyed this episode. Raising the Bar is powered by Altiqe Consulting, the country's leading independent expert in healthcare cost containment. Astute employers know there's a better way to offer health insurance, and we help them achieve it.